Good morning. Welcome to the York County Community Foundation's Impact 20 update. My name is Jane Conover and I'm the CEO and president of the York County Community Foundation. Impact 20 is a chance for us to share ideas and projects working in York County and have a chance for you to interact with us while we're doing that. So we encourage you to go to our Facebook page and post any questions or comments on our Facebook post, and we'll try to get back to you during this session. The York County Community Foundation is a charitable organization where hundreds of donors from around York County have pooled their resources here that generate up to $6 million in grants to help support positive improvements to people's lives and to make York County stronger. One of the other things we do is we convene people, individuals and organizations, to solve systemic problems that can be holding our community back. So we're excited today to talk about a partnership that we have with the Memorial Health Fund. The Memorial Health Fund was a private foundation that affiliated with the York County Community Foundation in 2015, and is a supporting organization of the foundation. Today with us is Lise Levin, our Vice President of Community Investment at the Community Foundation. She works and partners with the Memorial Health Fund, and she's going to tell us a little bit more about that and about an exciting initiative that they've launched. Lise?
Thanks, Jane. As a supporting organization, the Memorial Health Fund has its own separate board of directors with grant-making control, and it also takes advantage of YCCF's investment, administrative, and grant-making expertise. The Memorial Health Fund's grant program seeks to transform the way our community addresses compelling health issues, and it funds programs that improve the complete physical, mental, and social well-being of residents of York and its surrounding communities. Board members were really struck by the magnitude of the meal gap in York County. Many of Memorial's board members are actively engaged in healthcare in our community, and they knew that access to healthy food was a challenge. But when we received the grant application for a seat at the table in 2017, we were really shocked to learn that only 49% of the hunger needs in the community are being met. 49%. And as hard as everyone is working on this issue, we need to do an even better job as a community. We know that not having access to enough nutritious food is a barrier to good health. And that makes the grant a really good fit for Memorial to fund. But beyond the lofty goal of ending hunger, we were impressed by the structure of the project itself. 5 organizations came together using a collective impact strategy: Central Pennsylvania Food Bank, Catholic Harvest Food Pantry, New Hope Ministries, York County Food Alliance, and the York County Food Bank. It's a tribute to the intelligence and compassion of this group that each organization understood that getting food to people in need is a system. Each organization came to the table willing to put the needs of the people they serve first and to maximize the chances of ending hunger in York County. They used an independent consultant, a third-party consultant, the Food Trust, to analyze the data and produce independent recommendations for improving access to nutritious food in York County. Also, the plan aligns with Governor Wolf's report, Setting the Table, a blueprint for a hunger-free PA, and it's the first project in the region to do so. Their big goal, to help York County become hunger-free through strategic improvements to the entire system.
Wow, that's really an exciting goal. And we're so thrilled today to have a hunger expert with us. Joe Arthur is the CEO and Executive Director of the Central Pennsylvania Food Bank. Joe's a sought-after presenter on hunger issues both locally and nationally. Good morning, Joe.
Good morning, Jane, and good morning, Lisa, and all the viewers today. Happy to be here.
Thanks for being with us. You know, Lisa mentioned there's a lot of good work going on in terms of food pantries and meal programs in the community. It still sort of hurts, though, to think about our neighbors being hungry. Can you tell us more about why that is?
Yeah, I can. And first, I want to say York County is not unique. I think this project was just a much deeper look, but this is a national and a statewide problem. But this Seat at the Table project was really shining a bright light in all areas, all zip codes, really all street level communities within York County. So we just have a better grasp of what's going on now.
Mm-hmm. So what are the typical challenges for people getting access to food?
And access is a key word. So the issue isn't really not enough food in York County. This is a very strong food system here in York County. It's really more access and household resources. And then the ecosystem where people can go for help, really being effective and working together. And as we know from the study, that just doesn't always happen. Again, that's not just a York problem. That's really a national problem. But here we have some recommendations to work with to really fix some of those areas.
Are there a couple of recommendations that stand out to you in this report that you're excited about implementing?
Yeah, there really are. So we came away from this effort in our organization and within the partnership. And I really want to thank the partners, as well as the Memorial Health Fund and the foundation. This is really about social determinants of health, and eating habits is really one of the big ones. So some of the key findings were, for instance, geographically, the eastern side of the county is poorly served. Not that people that are in our organizations aren't working hard, but there's just not enough access to healthy food in those zip codes along the river, for instance. So we came away knowing we've got to do more work there. We've got to work with our partners there, maybe develop solutions that aren't in place. Could look like mobile pantries, deeper work with our schools to serve families, beyond the standard lunch and breakfast programs during the year. What about the summertime? And what about after school? Schools are amazing resources. Let's use it. So those are some of the findings we see.
That's great. We've heard the word partners a couple of times, both the partners who worked on this project and then those who reach out to in the community. How did you bring those groups together, and what are the opportunities and challenges that created when you're working in partnerships like that?
Sure. Collaboration is talked about a lot. But effective collaboration is the key. So we not only got together for 1 or 2 meetings, but consistently over the last 2 years during what we think of as the assessment phase of Seat at the Table, and really worked together, really sat down, reviewed the data from the analysis and research, and said, what is really going on in our communities? And that doesn't always happen. Right, that doesn't always happen in the charitable world or really the broader economy and so forth.
Because everyone's so busy.
They're busy, and we're running our organizations, and we want our organizations to do well. But for the community to do well, for households to do well, for people to do well, we actually do have to work together outside of our own organization. So I think we accomplished that so far. The partners came to the table and said we're going to actually work together. And that continues today. And as we move forward, we're drawing in more organizations throughout York County to work in the same way.
That's great.
I'd add a couple of things to that point. I think one of the things that was remarkable about this program was that we had Central Penn Food Bank in the lead. So as a regional food bank representing 27 counties, it really had the credibility to serve as the backbone of this project. I also think that Central Penn and the partners were together on the project from the very beginning. And I'd encourage anyone considering big initiatives like this to make sure that from the get-go, you have the people at the table who are going to be working together through that first phase of work. So they actually designed the program together. They designed the survey instruments together. And there was deep expertise at the table that I was so impressed. And as representing the funder, representing Memorial, I had the opportunity to be part of that table as well. And I could see the group really coalescing. There was deep trust when issues came up, and they did. They were discussed at the table. So there wasn't stuff going on that might poison the initiative and break the trust. Instead, it was voiced there. Sometimes those were difficult conversations, but the level of communication throughout the process was really extraordinary. And I think the trust and the communication and having the right backbone organization were all so central to making this project work the way it did.
Mhm. And it increases its chances of success, you know, in the
Absolutely.
future, and the sustainability of the effort. That's
Yeah.
terrific.
And I appreciate the kind words for Central Penn Food Bank, but the other partners we have been working with for many years now. We were working in some new ways here, but I really refer to it as an ecosystem or a network. And because we're regional, you know, throughout a large portion of the state, we do have access to resources from outside the county. And by working with local partners who really know their clients, that really know the challenges that they're facing right in our communities, it's critical that we work together. So we're just well positioned to do that. But we really have to complement our partners on the ground, because
Sure.
without them, we simply can't reach the people
Sure,
in need. So
sure.
we do have to work together.
You know, Lisa mentioned a little bit earlier about the impact of hunger on a person, but can you tell us more about the impact of not having enough food on a family and a child, and generally speaking, how that impact maybe ripples out to the whole community?
Yeah, it's actually a huge impact. And I mentioned social determinants of health earlier. So even from a health perspective, if you're not eating enough or not eating enough good food, nutritious food, you clearly have an impact on your health. That extends to your family, and then within the community, if we have families that are struggling to eat enough, we know that has impacts on the community. We know that more resources have to come to bear, that healthcare costs are going up, that in the workplace, many of our clients, they're working households. So could be one or two people or more working. How effective can you be at work? The children, how effective can you be at school if you're not eating well
Sure.
and nutritiously? So we all know that there are huge impacts. So the more we can get upstream and actually you know, prevent or solve hunger for families and help them help themselves, because they're the biggest asset in this work, the family itself. The more we can do that, the less of those negative repercussions that we have, and the money that you have to spend to solve them
Right.
can be saved.
Yeah.
Right?
Well, ending hunger in your county would be an amazing achievement. And have you given some thoughts of what success might look like for those families and for the community if you were able to end hunger?
Yeah, we think about it all the time, and this is a long endeavor because we need systemic change here and really throughout the nation. But if we kind of think forward 5 to 10 years, and we're getting close to, you know, solving hunger or ending hunger, think about the performance of children in school. Think about each of their individual pathways. Think about the family that now has confidence to know their children are going to do well. Think about the working folks in the household able to hold that good job, actually get to that good job. All of those things are impacted, and when you're hungry, that is your problem. That's the problem that's in front of you. It's not the only problem, but when you're hungry, you're focused entirely on that. And so how could you be focused on, you know, other things? So we really feel that if we can solve that, then a lot of our community challenges start to become solvable as well. So I think success, you know, looks like a county that really has minimized the amount of people that are food insecure and really is building on the strengths that creates.
Yeah.
You know, Joe, one thing that I know you once commented on that I thought was really interesting was that one of the things that you've learned in this work is that Central Penn also had to change how it works, which I think is interesting, because when you think of a backbone and a large regional food bank, you think, well, you have your problem solved. Can you talk a little bit about that?
Sure. You know, I think we were sort of a natural fit for collective work, but there's a lot of cultural change even in our organization and throughout our network of community partners. So healthy food in the last 10 years, we have worked very hard to do something that sounds easy, but is very hard. So trying to get even the food product that we provide to be what we call foods to encourage, or healthy food. That took monumental change and investment by the community or donors. but also changing how we think about food. So it's not just enough to have enough food, right?
Mhm.
What about the fresh produce? What about the fresh milk and all of those products? That's a lot of cultural change. And now, how do we fill the gaps? How do we get to people without building more pantries, right? All of that is really important work that's kind of new for us. So we're changing too.
Right.
So you're talking about culture change within the organization, but it's also, I would think there's a component of this about the training or providing opportunities for people who are using your food services to be able to use healthy food in a new way, right? So that they're used to maybe getting a piece of bulk food rather than some lettuce and squash.
Right. So there's now education around that. So we've built teaching kitchens within our two hubs, and some of our partners have built or are building teaching kitchens, and the purpose of that is to help their clients learn about how they shop. Right. Our clients have resources. How are they behaving in the grocery store? What are they doing at home? How are they cooking? What are they cooking? What are they not putting in their cabinets, right?
Mm-hmm.
So all of that's really important because in addition to the resources, there has to be education around it. And there are a lot of our partners that are not just pantries and so forth. Healthcare is a partner now.
Right.
We know people are working with their healthcare provider to improve their health. So we all need to be talking about the same kind of things with regards to what we put in our body.
Mm-hmm. Yeah, yeah, and also for the healthcare providers to know the resources that they can refer their patients to get assistance with that component of their health.
Right, and it's not often in some areas good healthy food in the food assistance system might not be available right now. So what we're working on is increasing that access, whether it's more hours of operation, better food at the pantry, so that when that person who needs it reaches out, when they pick up the phone, that they're actually going to find a place that has good food when they can get to it. And that's important.
In a community like York County, with agriculture being a large industry here, you'd think those
food's
points
a big deal
could connect a little bit. Yeah,
Right.
it'd be great to be able to engage the farming community in some way.
Yeah, and that actually the farming community is engaged. So our sourcing now goes right to the farm. All of our great food businesses that we're blessed with in the area that start at the farm, the larger ones are already engaged. But our work needs them to be even more focused on the healthy foods. Right.
So you put in a lot of good work in this report. You have important.
I should show the report.
Lisa has a copy of the report there. It's really well done.
It's a great report.
And it's a kind of a tool, a guide now for your next steps. So what would be those next steps you're thinking about?
Yeah, I think the first thing I want to say is what I said at the press conference a few weeks ago, right at this very location at the foundation, where oftentimes when you do a big endeavor like this, the report is like the end of the process.
Yes, right.
And this is actually the beginning of the process. The report has very clear recommendations for us. So now it's about implementation. I mentioned a few things already, but specific items like St. Matthew's Food Pantry has converted already to a choice pantry with healthy food. That means the client picks the food, but the food that's available there is healthier. If the client picks the food, they're going to actually use it. That sounds like a simple thing, but it's very hard to do in practice. What do we do going forward? Let's use that model with more of our local York pantries. And our food bank can help with that, and our partners can help with that. Schools, huge resource, often underutilized for this purpose. Even backpack programs, which are nice. It's more effective when you feed the whole family. So let's convert that to a school pantry. Let's serve the whole family healthy food for home cooking.
You know, we have a question from the audience, and it's related in a way to schools, in that, you know, we have a vision for what success could look like, but how will we know if children are getting good meals and good foods? What are there metrics we can track to see that that's impacting maybe their school performance, for instance?
I think there are, and that's new collaboration. So that involves some cultural change at schools. We're very ready to work with our schools to do that. They certainly are in a position to kind of monitor and over time see how children are doing that are, say, enrolled in a program like this. You know, let's track it, let's look at it, and then change our tactics to get there. With healthcare, we do have some similar work going on. They're certainly measuring the biometrics for their patients who are in programs like this. Let's work together and over time help improve their health.
And we know that hunger impacts families, and that's a compelling case. It also impacts older adults in a very significant way, in that they've limited resources often, and also can be not close to food pantries. So any particular effort you're making to reach out to older adults?
We absolutely do, through our traditional pantry services and some special services. We actually work directly with senior centers that are serving seniors in need. And oftentimes symptoms that look like dementia are actually things like not having enough nutritious food, dehydration. So we actually have some specific senior centers that we work with here and throughout our territory.
So yeah, having correct relationships with the healthcare providers is important to see if there's improved health outcomes as well for older adults and for children. Well, we're really thankful to you, Joe, for your hard work and for being with us today. And we're grateful to all of you for joining us today. There will be a link to this report, the full report, on our Facebook post, and you can also get it on the Foundation's website. Thank you so much to the Memorial Health Fund for helping support this important work, and to all of you for joining us today. Have a great day.